This week, we are reporting on the people of New Orleans and their continuing struggles 2 years after Katrina. And a growing problem is a lack of adequate health care. Only 8 of the 12 major hospitals are open, and more than 23,000 health care jobs have been lost in the region, forcing a handful of professionals to pick up the slack. Katie Couric continues our series, The Katrina Recovery. Follow the money.
Actually, it's pretty good. It's 130/70.
In her 6 years as a nurse practitioner, Scharmaine Lawson has been on medical missions to Puerto Rico and the Dominican Republic.
Has the eye doctor been out to see you?
But she had no idea she'd be doing third world work in her own hometown.
Homes that I've passed by all my life since I'm from here that are gone. Walgreens, CVS, grocery store, hospitals, gone. Good morning. How you doing?
Charmaine's practice consists solely of house calls, or in most cases, calls to the FEMA trailer parked outside the house.
You had 100 patients before Katrina. Now you have 500?
Yes. Hey, Miss Alice.
Patients like Alice Pierre, 67, who suffers from heart disease, back problems, and diabetes.
My sugar this morning,
What was it?
Oh my goodness, I have CRS now. Let me see.
What's CRS?
Can't remember stuff.
They're almost all elderly, in some cases bedridden. Those who can manage to get to a doctor often can't find one.
How would you describe the state of healthcare in New Orleans?
Still on the respirator. It's still in the ICU.
2 years after Katrina, and the healthcare system in New Orleans is as dilapidated as many of the still unlivable houses here. 4 hospitals, including this one, remain closed. Thousands of doctors have left, and a quarter of the adult population has no insurance.
Hospitals in this area are literally hemorrhaging cash and hemorrhaging resources.
Dr. Kevin Jordan, chief medical officer at one of the few remaining hospitals, says emergency rooms are even more overtaxed today because of the exodus of primary care physicians.
Tell me, how long is the average wait to see a doctor in this town now?
You can wait anywhere from a month and a half, 2 months to get a regular appointment, given that that doctor is willing to see you. Because remember, there's that much demand and that much resource.
Only 3 months ago, the federal government finally agreed to pay $100 million to fund primary care clinics in New Orleans. But earlier this month, Mayor Ray Nagin went to Capitol Hill and said, "Show me the money."
I keep hearing about this $100 million that's been allocated to the Gulf Coast, but I have seen very little of that money in the city of New Orleans.
Until it arrives, there are people like Scharmaine Lawson, who's not just a nurse. In fact, in her current role, she's social worker, financial advisor, even detective. So many medical records were lost or destroyed, she had to piece together countless patient histories.
A lot of patients I went out to see didn't have any records, didn't have anything.
And because mental health services are woefully inadequate, some say non-existent, she is part-time therapist as well.
You have had some pretty tough problems with depression, haven't you?
A lot of things came through my mind, but I had to ask God to forgive me because I just didn't want to be here anymore.
Why do you do this?
I'm from here, and my grandmother who raised me, when she got ill, it was very difficult for her to get out to see a doctor or anyone to help her. Let me give one more last hug goodbye. So whenever I see little old ladies like Miss Alice, I feel like I'm doing it for her.
Katie Couric, CBS News, New Orleans.